All right, welcome to the deep dive, where we help you conquer the MRCS exam one crucial concept at a time. Today, we're going to dive into airway management and ventilation. Think of this as your rapid-fire review session before the big exam, so let's just jump right into it.
Sounds good.
When you're assessing a patient's airway, what are those critical things you absolutely need to know?
Well, you really need to take a systematic approach to this and use all your senses, look, listen, and feel. Visual cues are going to be absolutely crucial here.
Go ahead.
For example, you want to look for symmetrical chest wall movement. Are they using accessory muscles to breathe? Is there a foreign body obstructing the airway? And also, be observant for any seesaw breathing, which can indicate severe respiratory distress.
Okay, so we're not just glancing at the patient. We're actively looking for specific indicators.
Exactly.
What about listening? What kind of sounds should really make us concerned?
You want to pay close attention to sounds like coughing, gagging, or choking.
Yeah.
Those are obvious signs of airway compromise. Stridor, a high-pitched sound during inhalation, often points to an obstruction in the upper airway. Gurgling, on the other hand, usually suggests the presence of fluid or secretions in the airway.
Got it. So each sound can point to a different issue there. And lastly, we have the feel component of this assessment. How does feeling the chest wall and airflow help us out here?
Feeling allows you to confirm what you're seeing and hearing. You can check for symmetrical chest wall movements and feel for aeronasal airflow to assess the effectiveness of breathing. These tactile cues add another layer to your assessment.
Okay, so we've thoroughly assessed the airway now. How do we manage it?
Airway management can range from simple maneuvers to life-saving interventions. So basic maneuvers like suctioning to clear the airway, the head tilt chin lift, and jaw thrust can be used to open the airway quickly.
Makes sense. So those are like our first line techniques.
Yes, exactly.
What about when those aren't enough? What other tools or adjuncts do we have?
Yeah, that's where airway adjuncts come into play. Oropharyngeal and nasopharyngeal airways help maintain an open airway, particularly in unconscious patients. So these devices are essential for keeping the airway clear and unobstructed.
All right. And then in those really critical situations where we need to secure the airway definitively.
In those cases, you're moving towards more advanced techniques like pertracheal or nasotracheal intubation to secure the airway with an endotracheal tube. And in the most extreme situations, a surgical airway like a cricothyroidotomy or tracheostomy might be necessary to bypass an obstructed upper airway.
Speaking of tracheostomies, there are so many different types and terms.
Yes, there are.
Can you break down the key differences between them?
Certainly. Let's start with timing.
Okay.
Tracheostomies can be elective, meaning they're planned in advance, or they can be emergency procedures performed in a crisis. Then you have the types of tubes. Cuffed tubes provide a seal around the trachea to prevent aspiration, while uncuffed tubes don't have that same level of sealing, but may allow for easier speech. There are fenestrated tubes, which have a hole to allow air to pass through the vocal cords for speech, and unfenestrated tubes without this feature. Then we have the techniques. Open tracheostomies involve a surgical incision, while percutaneous tracheostomies are performed through the skin with minimal invasion. And finally, the material. Silver metal tubes are typically used for long-term tracheostomies, whereas plastic tubes are often used for temporary airway management.
So with all these variations, what are the potential complications that we need to be aware of?
Bleeding is a major concern, as it can lead to aspiration and compromise the airway further.
Right.
You also need to be vigilant about subcutaneous emphysema, which is when air gets trapped under the skin. Infection is always a risk with any surgical procedure, and tracheostomies are no exception.
Of course.
Long-term tracheal stenosis, or narrowing of the trachea, can occur. And of course, there's the risk of misplacing the tube during a change, which could potentially damage the brachiocephalic vein, a major blood vessel.
Okay, so those are all things to watch out for.
Yes, definitely.
Now let's shift gears to assisting ventilation. What options do we have when a patient needs help breathing?
We can provide support with non-invasive positive pressure ventilation, or NPPV, which includes BiPAP and CPAP. BiPAP, or bilevel positive airway pressure, delivers two different pressures, one for inhalation and one for exhalation, which can be helpful for patients who need extra assistance with both phases of breathing. CPAP, or continuous positive airway pressure, provides a continuous positive pressure to keep the airway open and improve oxygenation.
In what clinical scenarios would we typically use NPPV?
It's often used in conditions like COPD exacerbation, where patients struggle to breathe effectively, acute pulmonary edema, where fluid builds up in the lungs, pneumonia, where inflammation impairs gas exchange, and even when weaning patients off mechanical ventilation to help them transition to breathing on their own.
And when those non-invasive methods are not sufficient, we move to invasive positive pressure ventilation.
Right.
When is that crucial intervention required?
Invasive ventilation is implemented when a patient's respiratory effort is failing, such as in cases of severe respiratory failure, or when they need airway protection to prevent aspiration. Basically, when their life is at risk and they can't breathe effectively on their own, we step in with invasive ventilation.
Got it. So it's really a life-saving measure.
Yes,
Now
exactly.
let's unpack the different types of mechanical ventilators. What are the key distinctions between them?
Mechanical ventilators can be categorized by how they deliver breaths. Volume-cycled ventilators deliver a preset volume of air with each breath. Pressure-cycled ventilators, on the other hand, deliver breaths until a preset pressure is reached. Flow-cycled ventilators deliver breath based on a preset flow rate, while time-cycled ventilators deliver breaths at a predetermined frequency, ensuring a consistent respiratory rate.
And finally, can you explain the different modes of ventilation and how they work?
Let's start with controlled mechanical ventilation, also known as continuous mandatory ventilation. In this mode, the ventilator delivers breaths regardless of the patient's effort. It's essentially doing all the work of breathing for them. Then there's assist control ventilation, where the ventilator delivers a full breath when it senses the patient trying to initiate a breath. It's like giving the patient a boost with every attempt. Synchronous intermittent mandatory ventilation, or SIMV, provides a set number of breaths per minute while allowing the patient to take spontaneous breaths. Between those ventilator-delivered breaths, this mode promotes some degree of patient effort and can help them wean off the ventilator more gradually.
You mentioned PEEP and CPAP earlier.
Yes.
How do those adjuncts contribute to optimizing lung function and improving patient outcomes?
PEEP, or positive end expiratory pressure, is applied at the end of exhalation to maintain a positive pressure within the lungs, preventing the tiny air sacs called alveoli from collapsing. This helps improve gas exchange and oxygenation. CPAP, continuous positive airway pressure, is similar to PEEP but is primarily used in spontaneously breathing patients to keep their airways open and improve breathing efficiency.
Excellent. That was a really comprehensive review of airway assessment management and the various methods for assisting ventilation. Crucial concepts for any surgeon preparing for the MRCS exam.
Absolutely.
Now keep in mind, this was just a focused review. Your textbooks and practice questions are essential for deeper learning. Best of luck with your exam prep.
Thank you for having me.